At the same time, we have to create a society in which the healthiest choice is the easiest choice.
Right. Thanks, Larry. Now, since we are experiencing the COVID-19 pandemic, so we're getting some questions about breastfeeding during COVID-19. Is it actually safe for a mother who is confirmed or even suspected with COVID-19 to breastfeed?
Yes, the WHO guidelines are very clear on this. We recommend continued breastfeeding, even for mothers who have a confirmed case of COVID and are hospitalized and are being taken care of. If she's at all able to hold her baby and care for her baby while she's in the hospital, we recommend that breastfeeding needs to continue, and it needs to be directly at the breast. There needs to be skin-to-skin contact, no separation. And the reason for that is that the benefits of breastfeeding are so huge that we shouldn't be trying to protect against one immediate possibility. The fact is that the transmission of the virus through breastfeeding looks to be extremely rare. There are very few babies who have gotten sick with COVID. There's really been no documentation so far that it necessarily has happened through breastfeeding. We're not saying that it's not possible, and so there might be some individual cases where it could happen, but it seems to be so rare that the baby will actually catch COVID. And then what we find is that the infection is very mild in most babies. So very few babies are suffering with any severe consequences of COVID. And so we need to stop worrying about we want to protect this particular infection, and at the same time create this risk of so many other infections for babies who are not being breastfed. On a global scale, we actually estimate that there are 820,000 child deaths associated with the lack of breastfeeding. And so we don't want to be putting up a situation where we're exposing children to many other risks because we avoid breastfeeding just because we think there might be a possibility of transmission through that. So we strongly recommend that breastfeeding needs to continue. There needs to be continued contact between that mother and baby because of the many health benefits that come from that.
Right. Thanks, Larry. And actually, I can share my personal experience. I had COVID myself in March this year. And I actually continue breastfeed my son, who's 2.5 years. And I put on mask every time he's around me. And he never actually get infected with COVID. So it was, for me, it was actually probably would be more stressful if I had to suddenly stop breastfeeding. More stressful for me and also for him. So that's from my personal experience breastfeeding with COVID.
It's great. It's great to hear your personal story there, and I'm glad you mentioned the wearing the mask because that is important. We do recommend that breastfeeding continue, but it does need to continue with the standard infection prevention control measures. We need to make sure we're washing all of the surfaces, anything that the mother may have coughed on. If she needs to be wearing a mask herself so that she's not breathing directly on the baby. The primary mode of transmission of COVID is through respiratory droplets. And so, yes, we want to protect against that. The transmission through breastfeeding, as I said, has not really been documented. But that doesn't mean that we don't want to still try to protect the baby from any infection. And so, as your example has shown, the baby is typically protected as long as we have that kind of respiratory control.
Right. So put on mask, clean your hands, hand wash with soap and water, or use hand sanitizer, and also clean the surfaces around you. Those are the steps that needs to be taken to if you decide to continue breastfeeding. Correct?
That's correct.
Yeah. And still in relation to the pandemic, WHO and UNICEF actually call on governments to urgently strengthen legislation on the code, and that government and civil society organizations should also not seek or accept donations of breast milk substitutes in emergency situations. Can you elaborate more about this, Larry, and why is that?
So this has been a longstanding policy related to the code, but it also stands in many of our emergency policies that we don't want to have donations of supplies of infant formula given in any of these circumstances. While it is recognized that there are some babies who will need formula, it tends to be a fairly small number of children. And the problem is when we get free donations of supplies, it does a couple of things. One, it creates a relationship with the donor. And so the people who are working in the emergencies start to feel like, oh, this is a good company, we want to work with them, and they end up inadvertently promoting the products of that company. The second thing that it does is it creates this free supply of products that can be distributed very broadly, even when they're not needed. And so mothers who are perfectly able to breastfeed in the distribution programs because, well, this can is available just in case you need it, it becomes too easy to say, well, let's just go ahead and use this to supplement our babies. And what happens in the emergency situations is that supplementation is probably more dangerous than ever. And so we're putting babies at risk just because of the free distribution of these supplies. We recognize that supplies are sometimes needed, but the best way to handle those is through normal purchasing mechanisms so that just as the emergency workers are having to purchase supplies for everything else, they need to get those supplies through normal channels so that they can manage them in normal ways and give them out to the babies who need them, but not as a general blanket distribution. And so we find that that's a really dangerous avenue to go when we start moving into free distribution or free samples.
Right. Thank you, Larry. And thank you also to our audience who have sent in some questions. We're also getting some generic questions on breastfeeding, which are interesting. Question from Milena on Facebook, Larry. She wants to know if it's okay to breastfeed while being pregnant.
Absolutely. There's not been documented any harm to either the growing fetus or to the baby who's being breastfed. In fact, there are many mothers that will continue breastfeeding through the time of the birth and starts breastfeeding both children, the newborn as well as the older child. It's called tandem nursing, and there's not been documented any harms with that. Many mothers do find that they do tend to wean toward the end of pregnancy, either because the older child is just getting old enough that they show less interest in it, or she finds that she'd rather be doing one at a time. So it's not highly common to do tandem nursing, but there certainly is no harm to it, and it is certainly good for the older baby to continue to receive those benefits of breastfeeding throughout that time period. And as we said earlier, that long-term breastfeeding is good for the mother.
Thanks, Larry. Another question from Priyanka on LinkedIn. She wants to know if expressed breast milk is equally beneficial, like when baby actually breastfeed directly.
So this is an issue that we're looking at a lot more closely now, and I don't think that the science is really crystal clear yet. We know they're not the same. And it definitely looks like feeding of breast milk is not as good as feeding directly at the breast. And there are a few reasons that we think that is of concern. One of the ways the breastfeeding works is that the mother herself is making antibodies in response to the environment that she has. And so if there's something floating around, some infection, she's creating those antibodies and is expressing them into her breast milk. And those get passed on to the baby and is one of the ways that the baby gets protected. If you express that milk and you put it in a freezer and don't feed it to the baby until 2 weeks later, well, that infection has already passed and is no longer in the environment that they're both living in. There's also concerns about differences of the milk during a feed. So the normal pattern is that the milk at the end of a feeding tends to be higher in fat than it is at the beginning of a feed. And so there's this kind of cyclical pattern to feeding at the breast. Whereas when we express into a bottle and then feed that mixed up milk, the baby isn't getting any differences from the beginning of a feed to another. And so that might be related to issues of recognition of satiety in the baby, that they don't recognize when they should stop feeding, and might be related to long-term development of childhood obesity. There are also concerns that some of the nutrients might be lost when it's stored. It's not a huge problem, but particularly the bioactive factors might be dying out. And there's so many different components of breast milk, some that last for a very long time when they're in the refrigerator or frozen, others that don't last quite as long. And so the science on this issue is very complicated. We're still trying to really understand what those differences are. All that said, if a mother can't breastfeed at the breast, then we certainly would consider that her expressed breast milk is much better than infant formula is. But really trying to find what's the best option. We should always be looking for direct breastfeeding at the breast whenever possible.
Great, thank you, Larry. Yeah, it's quite amazing what nature breast milk can actually do. Like the way it regulates, like what you said, like the fat towards the end. I found that really fascinating how nature can do that.
The biology of lactation is truly fascinating, and if you think about it, yes, from an evolutionary standpoint, it makes sense. We are mammals. That what defines us as mammals is this ability to feed our young with this milk. And to think that in basically 100 years, we're going to come forward with a science that's going to completely change that, and come up with something totally just as good as what Mother Nature is able to do over the course of millions of years, just doesn't really make sense.
Indeed. We have two questions in relation to stimulating milk production. From Sharnay, who asked, how can a mother boost the milk production naturally? And the other question is if there is any specific food that can help the milk production.
So the most important thing for milk production is getting the baby latching correctly at the breast, attaching, and drawing down milk with a good feed each time. The lactation normally operates on a supply and demand. So the more milk that is taken from that breast, the more she's going to produce milk, and that really is the primary thing that we need to focus on. It is true that there are women who have a little bit more difficulty and need more support with producing milk. Certainly, having more liquids in her diet, drinking lots of water, is recommended to keep up a good milk supply. And there are various herbals that can be tried. There's mixed success on those, but many people do find that certain ones are very beneficial. There's not a strong science that says, these are the specific ones that are absolutely needed. It does seem to vary from mother to mother, and a lot of mixed experience there. In terms of foods, there's not really any specific foods that are recommended or not recommended. Just a normal, healthy diet is what's best for breastfeeding, as well as best for the mother.
Right. A question from Annalisa Tortora. What about nursing a child that is not your own? Can an infant that's not your own benefit the same?
So this is a behavior we call wet nursing, where a baby is not fed by mother, but fed by someone else. And there's likewise not been huge literature documenting the health effects of that. It's not common enough to easily study. It depends a little bit on how it's being done. The benefits of the breast milk itself are probably quite important, and if that mother herself, that wet nursing mother, is healthy and living in the same environment, probably can do just perfectly fine. There's not really a biological necessity that it needs to be the same mother who delivered the baby that is feeding the milk, and so those benefits are probably quite good and quite strong. One of the concerns that we'd have about wet nursing might be if she's living in a different environment. She's not having the same exposures that the baby is having. And so it might not be getting those kind of antibodies that we talked about earlier. And sometimes in some cultures, the problem is that wet nurses themselves have health problems. And so you might be putting the baby at a little bit of additional risk. But if there's good screening and the other mother is doing perfectly fine, there's probably not any significant risks to be concerned about there, and probably quite beneficial for the baby.
Right. So in relation to that, there's a question about how about using milk banks during COVID-19?
So human milk banks are primarily designed for the feeding of very young preterm babies in the hospital. And it is a critical need for many of them. Mothers who have not gone through a full pregnancy often have difficulty getting their milk supply up in the first few weeks. And so having those babies be fed on human milk, even if it comes from other mothers, still protects them against many diseases. There's a significant condition in preterm babies called necrotizing enterocolitis that's extremely dangerous, high death rate. And the feeding of human milk, even from a donor human milk bank, is quite important for them. In the time of COVID, there's no particular concern about milk banks. In fact, as I said, it's so rare that COVID could be transmitted, even if there were a mother that had COVID who happened to be a donor. There's probably either zero risk or close to zero risk that could be passed on to the baby. So it's not really a health risk that we'd be concerned about. One of the concerns we have had about donor human milk banking during COVID is just how do we keep the supply up for many mothers who are socially distanced and are not able to go out into society. Are they able to bring their milk to a drop-off point? Or are they closing off and saying, "Oh no, I can't go out"? Mothers who might be screened medically to make sure that they're going to be a safe donor, they don't go to the doctor. Because the doctor's offices have been closed, or they're not seeing patients unless they're extremely ill. And so there is concern about being able to maintain that supply right now. As societies are starting to open up more from the social distancing, some of those problems are probably going to become less of a concern. But we certainly need to be watching how this is going and make sure we can maintain a good supply of human milk through milk banks.
Great, thanks, Larry. One last question in relation to medical professionals. What can they do? What kind of improvements to ensure medical professionals are better educated to support mothers to breastfeed? And this is in relation to what you talked about earlier.
Sure. So they need to make sure that they are well educated on the importance of breastfeeding. And perhaps more importantly, or at least equally importantly, how they can support mothers with breastfeeding. Oftentimes that's not built into medical education, and that's something that we need to change. We need to change the curriculum in medical education. We need to change the testing and exams to make sure that there are more questions about breastfeeding so that there's an incentive to really get that education. But for health professionals who are already working, they need to seek out those opportunities. In most countries, there are continuing medical education requirements for health professionals, but those requirements are very general, that you need to get medical education on something to stay up to date, but there's nothing that requires it to be about breastfeeding. And so there is a responsibility on healthcare providers that they need to seek out those courses. They need to find the ways to get that education so that they can have the skill sets that they need. They also need to work with the healthcare professionals that have that. So if there are lactation consultants in their community, how can they partner with those lactation consultants? Sometimes they look down on them because, oh, this person doesn't have an MD after their name, so I don't want to refer to them, when in fact they might have exactly the skill sets that they need. Then the final thing I would mention is that they need to make sure that they are educating themselves about their responsibilities under the Code of Marketing of Breast Milk Substitutes. There are many ways that they might be inadvertently promoting promoting breast milk substitutes without even knowing it. That calendar that they accepted and put on the wall that has the logo of some company gives some subliminal messages to families that infant formula is just fine because I saw it at the doctor's office, or he was using a pen from that company. It must be a pretty good company. And they're not necessarily conscious messages, but those are the messages that they need to be very careful about in their own practices.
Thank you, Larry. So I think when it comes to breastfeeding, it's actually not only the mother's responsibility or women's responsibility, but also man, family support, healthcare professionals, even government. And with that, I would like to thank you, Larry, for your sharing what you know to our audience on Twitter, Facebook, LinkedIn, and TikTok today. And I would also thank all of our audience. We get many people around the world: Bangladesh, Iran, Albania, Angola, UK, Senegal, Tanzania, Jordan, Brazil, Nigeria, Indonesia, selamat sore, the US, Kenya, Bangladesh, Libya, Sudan, and many, many more. Thank you for joining us today, our live Q&A on breastfeeding. You can find more information about breastfeeding, including breastfeeding during COVID-19, on our website, www.who.int. And join us on our next live Q&A. Thank you so much.
Thank you very much. Enjoyed talking with you today. Bye-bye.